what I do with my team at UE LifeSciences is bring access to early detection and necessary navigation to cancer. This has been a gaping hole in the developing world as it strives to rise. It's really holding the communities back because it is a non-communicable disease that comes with progress. And so me and my partners, Matthew Campisi and Baumik Sangvi, we saw this 16 years ago when it started happening in our families. My mother-in-law was diagnosed with breast cancer, and we learned that her optionality to survive greatly mattered where she lives. And I was in medical technologies by then, pursuing an entrepreneurship career in medtech, to realize that there is a tsunami coming to the developing world, to these frontier markets, where there is no solution. The solutions developed, the mechanisms developed to address this challenge are unsustainable, unaffordable, inaccessible, inapplicable to many of the developing world countries. And so we've embarked on this journey some time ago, and we are making some really decent progress that I'd love to share with you guys.
Thank you so much. Such important work. Can you share with us a little more about the approach or the product that you have?
Sure. So what we realized, Mirek, is that nobody is innovating for the bottom of the pyramid, where the bottom of the pyramid issues exist, meaning in large volumes. And so we saw that mammography, which is this gold standard test considered to be the pivotal test for breast cancer screening, is not going to reach 90% of the global women's market. And governments weren't in the know of this back then. Now there is a lot of appreciation and understanding for that. So we rolled up our sleeves and said, all the reasons why mammography doesn't work, can we figure out an engineering solution to that? And so we've devised this handheld set of products, one called iBreastExam. It basically equips a community health worker and turns her into an amazing, excellent, high-quality breast examiner. And we've done that using technology that we all have in our mobile phones, the capacitive sensors. But we've tuned that sensor to look for tumors in the breast. But this could be done in the field, without internet. It works days on end on battery. And now you're able to bring all this data to the cloud so that the health system can identify who exactly in different towns is needing that necessary diagnostic step. And so we are providing that critical infrastructure in the shape of that handheld device, which is used by a lady who lives and works amongst the community, by bringing that access to early detection, but also the navigation to bring that person into treatment, which is crucial. Post-innovation scale-up is the fruit that every entrepreneur is chasing, because that's the road for impact and that's the road for growth, right? And the whole team, whether you're individual or with a small team, as I was, I think you were as well, right? You all take on that mental that we will stay in this game together no matter what it takes to get it past that zone. But then to arrive there and then to see that nobody else is there and you're going to have to do the next set of steps yourself is a daunting challenge. I'm just coming back from the World Cancer Congress, where the Union for International Cancer Control, UICC, and BBC Storyworks produced a series called Rewriting Cancer. And UE LifeSciences is, I'm proud to say, is featured in 18 of one of those stories. And it really the story tells the success. It actually tells the story of this woman, Asha, which by the way means hope. How she ran into this technology in her little town in Goa, India, and was able to find her breast lump early, which was cancer, and got treated. And the story ends with her being restored with hope, which is her namesake. But this is what's happening now. With our company, we are reaching now a couple million women and hope to reach 10 million women. But that is a drop in the bucket. There's more than 1 billion women that need this early detection for breast and cervical cancer. And the technologies are there. We validated them. We've proven them. We built these partnerships. But the World Bank doesn't talk with World Economic Forum, doesn't talk with World Cancer all worldly agencies. I'm being a little edgy here. But you can hear the entrepreneurs' true request for support and collaboration, because we are overzealous to solve these problems as much as you are, and we just have the right kind of compatible resources.
How is your product actually distributed?
So, like him, we also figured out an innovative business plan. We figured out that if you separate the scanner, the machine, from the exam, which is really the early detection, you could then really free up the ability for the technology to scale. And what I mean by that is, we have a device in which there fits this center of the technology, which is the capacitive sensor, but it's good for 500 women to be screened. And so once you finish those 500 women's exams, you only buy another one from us. And so your cost per woman screened would be less than a cost of a coffee cup or a latte. And it's market contextualized for Colombia versus India versus Malaysia because there are different GDP structures and different types of health systems. Now we are reaching a place where we are offering health systems a consolidated, almost outcome-like package where we say we will provide the machines for free. We will give you the training to your health workers for free. We will monitor their quality for free. We will take all the data and give it to you in a reading room as part of a single per woman exam cost. So that really becomes an all-inclusive kind of an offer for the government to say exactly what's my impact and what's the return on investment.
Absolutely.
But so it would be then relying on, you mentioned health systems, so it is relying on these contracts with health authorities, or is it so it's not available to customers in pharmacies or?
We are getting there. So in arc of innovation and validation and all that takes a long while, but with the capacitive sensor, we've realized that not only can this be made available in primary health clinics of any government in any country, virtually any country. And so, yeah, we do work with governments and nonprofits a lot. We work with a lot of CSR-supported projects where corporates are paying for the towns where they're operating or cities to be provided this feature. But now we are realizing that there is a private market solution. What if we offered a woman a 12-month assurance following our test that all her diagnostics will be covered? Even a consultation with an oncologist, or maybe even a biopsy would be covered. It literally becomes that peace of mind for 1 year. And so we are starting this initiative this October called Think Pink, and it's all about outsmarting breast cancer, because we think that a $30 investment for most women in developing world urban areas are able to make this kind of investment. And sorry if I may just add.
Yes, please.
And from there we are leapfrogging towards a consumer solution that women can use at home.
Wow.
That would be.
So we are now working. We've been in talks with FDA for about a year and a half. Basically, 30% of all breast cancers in America, 30% of all breast cancers in America are not diagnosable or detectable by mammogram. And these breast cancers are 3 times more likely to kill women than the screen-detected breast cancers. So you see the vulnerability? In a country that spends $18 billion screening for breast cancer, you have a gap for 30% of breast cancers not being found because they happen between 2 mammograms. So we are developing a handheld solution, very much like I call it the Apple Watch of breast health, where women will be able to take our innovation that has been tried and tested in millions of women and be able to use it at home on themselves, and thereby improving their ability, empowering their ability to find their cancer early. Now, this could be super helpful for women below 40 for whom there is no mammogram. African American women have a 40% higher disparity in America than white women. So this would be creating health equity. And by the way, the rightful award that we won from you, I think, would kind of continue to stay true, I think, as we go on this path, because we are looking to literally address every health disparity related to breast cancer screening. I've been at this for 25 years now, medical technologies in the developing world. And the biggest gap I've seen is what you just described, there not being an infrastructure to work through for the innovation. So everything then becomes the responsibility of the entrepreneur and his team. Show that it works technologically, show that it works medically or clinically, show that it can be produced, show that it can be FDA approved and through the regulatory channels. All these steps become the responsibility of the entrepreneur who is trying to make a social difference. And so profit is like way back where somewhere we left that. And I told my wife recently that imagine I ran an NGO for 15 years and we just turned a profit-making company. Because now we are at a place where we have scale, we have healthy revenues, we are growing, but an infrastructural support that fosters the innovation from academic, and that's where our technology comes from. We licensed it from Drexel University. And before you know it, it's in Fiji, and before you know it, it's in India, and it's actually making a difference. So making these kinds of ties and support structures would let the naive entrepreneurs innovate more feverishly, if I could say that.